The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on today, Saturday, February the 6th, 2021. Now, at the end of this episode, I'll tell you why I wasn't on Friday. But hey, do me a favor. You're going to do me a favor. Now, someone just said, it all depends on what it is. Well, I'm going to tell you what it is. I want you to look at your hands, especially your nails. Did you know that your nails can tell a lot about your health? And someone just said, what does this have to do with autoimmune disease and lupus and Raynaud's disease? Well, stick around and I'll explain it to you. Okay? All right. And we're going to be discussing racial bias in medicine, which is a subconscious barrier to C19 equity. That's right, people, come on now. Some of you may not realize, and some of you may realize, that it is a lot of racial bias within the medical community. And we're going to be discussing it. And yes, I'm talking about it again. So, you know what I want you to do? All the way from Detroit, Michigan to Lombardy, Italy. Get ready to grab your cup of coffee, your cup of tea. And to my listeners late at night, you know I appreciate you. So get ready to grab your favorite glass of wine and come on and join the conversation right here on My Story Living with Lupus podcast. The Charlie E. and Minnie P. Hendricks Foundation for Chronic Illness Awareness, giving hope and empowering those who suffer with chronic illness. See one, reach one, educate one to empower the masses. You can contact the foundation at 313-303-9217 or visit their website at https://cemphfoundation.com. This is a 501c3 organization. No one should live in lack. All contributions are tax deductible. We're back and we're discussing nails. once again, take a look at your nails. Are they curved? Now, a person's nails can say a lot about their overall health, while changes to the nails may suggest an underlying issue that needs treatment, such as nail psoriasis. That's right, you heard me right. Nail psoriasis or Raynaud's disease. Now, the curving of the nails does not always indicate a cause for concern, but it may be a good idea to consult a doctor. If changes to the nails accompany other symptoms, it is important to seek care promptly. Now, some people, well, let me put it to you this way. Have you heard of the phrase spoon, S-P-O-O-N, nails? Spoon nails. The nails become so soft and curved that they can hold a droplet of water. This issue may occur in newborns, but it may resolve without needing treatment. In other cases, and in people of other ages, it may indicate health issues such as iron deficiency, anemia. Now, nails that curve at the tips. This involves the thickening of the tissue underneath the nail, causing the fingertips to become rounded and the nails to curve over them. Now, I've seen people, especially some females, where their nail is like curved slightly, and I've always wanted my nails like that. Now, it may sound strange, or you may say, oh, that's so silly or stupid, but I've always wanted that, just a little bit of the curve in my nails. Now, doctors believe this results from increased blood flow to the fingertips. It can run in families and may be harmless, but it may be due to a health condition, especially if it occurs later in life. Now, for those nails that curve around the sides, now when your nails curve far inward at the sides are called ingrown nails. This condition may affect the toenails and be due to wearing shoes that are too tight, particularly in the toe box. Those pointed toe shoes. I used to wear pointed toe shoes, but I didn't have the ingrown nails because I stopped wearing them. Now, ingrown nails may also result from cutting the nails improperly. In some cases, treatment may involve removing part or all of the nail. Now, other nail issues. The nails may become crumbly or brittle due to fungal infection, lichen planus, an inflammatory skin condition. We talked about that on the podcast also, thyroid disorder, and nail cirrhosis. Now, if you have small dents or pits in your nails. It may result from eczema, psoriasis, reactive arthritis, and even alopecia, an autoimmune disorder that often causes hair loss. Now, causes for curving of the nails sometimes stem from an underlying health issue. This may be temporary, such as a fungal infection, or chronic, such as psoriasis. Now, iron deficiency anemia. Iron helps maintain healthy cells in skin, hair, nails, while an iron deficiency may be due to an underlying health issue, pregnancy, heavy menstrual cycles, or a diet low in iron. Some common symptoms besides curved nails may include paleness, fatigue, weakness, a rapid heartbeat, a sensation of pounding in the ears, headaches, and hair loss. Now, treatment for iron deficiency anemia may involve eating more iron-rich foods. These include beef, pork, lamb, liver, eating broccoli, kale, collard greens, pinto beans, and black-eyed peas, taking a high-dose supplement. And your doctor can recommend or prescribe a sufficiently high dose supplement for you. Intravenous supplementation. A healthcare professional may recommend this for people who are unable to pass iron through their gastrointestinal tract. Now, when it comes to nail cirrhosis or psoriasis, about 90% of people with psoriasis or cirrhosis develop the condition on their nails at some point besides curving. Symptoms may include thickening and shallow or deep holes in the nail. Treatment may involve topical creams or ointments, light therapy, injections, and oral medication. Now, Raynaud's disease, which is a rare disorder, affects the arteries, causing them to periodically narrow and block blood flow to specific body parts, usually fingers and toes. As a result, the fingers and toes may turn pale or white, then bluish, feel numb, cold, or painful, redden, throb, burn, tingle, or feel numb. Now, treatment for Raynaud's may involve managing stress or taking medication, or rarely undergoing surgery. However, there is no cure. Hemochromatosis. This genetic disorder causes the body to absorb too much iron from the diet, while a person typically has around 1 gram of iron in their body at any time. This condition can cause a build-up of 5 grams or more. Besides curved nails, symptoms may include hair loss, skin discoloration, weight loss, early menopause, joint pain, abdominal pain, liver dysfunction, sexual dysfunction, and weakness and lethargy. Hemochromatosis can damage the liver, heart, and pancreas. Without treatment, people may show signs of iron toxicity in their 30s, and the disease may be fatal. Management involves the regular removal of blood until iron levels are within normal range. Systemic lupus erythematosus. We all know that this is a chronic disease, and it can cause or trigger inflammation and pain in any area of the body. We know that about 1.5 million people in the United States have a form of lupus, while systemic lupus erythematosus is the most common type. Symptoms of this autoimmune disorder can flare up and recede. Beyond curvature of the nails, they can include fatigue, rashes, joint swelling or pain, fevers, sensitivity to sunlight or fluorescent light, and lung problems. Treatment generally focuses on suppressing the immune system with medication. Now, were you shocked when I stated that with lupus, you have a curvature of the nails? Don't be. As I said plenty of times before, there exists more to lupus than that 5-letter word LUPUS. That's why it's important that you do your research and find out for yourself. Now, this was all about the nails and how your nails can tell when there's something going on with your health that you need to check out. Remember, always consult your physician before doing any other treatment. Stay with me, and when we return, we'll be discussing racial bias in medicine, which is a subconscious barrier to C19 equity. So stay with me. Ophthalmology Associates, PC, Drs. Berman and Dr. Zuckerbrod, treating diseases of the eye and eye surgery. You can reach them at 313-341-3450. All right, and we're back. And we're discussing racial bias in medicine, subconscious barrier to C19 equity. And when I say C19, I'm talking about, if you don't already know, I'm talking about the pandemic. Now, for those of you who may not truly understand what health equity is, it's important for me to try to describe and give you the definition of health equity. Health equity, synonymous with health disparity, refers to the study and causes of differences in the quality of health and healthcare across different populations. Health equity is different from health equality, as it refers only to the absence of disparities in controllable aspects of health. Health equity is the pursuit of an equal opportunity for all people to achieve their best possible health. Now, this means deploying solutions that are capable of meeting the magnitude of the barriers or problems that impede the realization of optimal health, especially for marginalized groups. Health equity is an authentic expression of an organization's commitment to the ideals of social justice, respect, access, and dignity. Health equity initiatives must be action-oriented and embedded in the authenticity of an organization. It requires cultural change in most organizations. Now, when it comes to racial bias in the medical field or in medicine, a subconscious barrier to CV-19 equity. Efforts to curb implicit bias in the medical field can lead to better care and better health outcomes. The disproportionate impact of CV-19 on American population of color relative to white Americans should force every one of us to examine how implicit bias contributes to health disparities. And hopefully, after you listen to this, you will come a more empowered advocate for yourself and hopefully for those within your community. As of early January, did you know 1 in 595 Indigenous Americans, 1 in 735 Black Americans, and 1 in 1,000 Latino Americans had died from CV-19 compared with 1 in 1,030 white Americans. A recent study suggests that structural circumstances in Black and Latino communities, such as housing inequality, which we have been fighting for a very long time, access to health care, limited employment opportunities, and poverty may explain the disproportionately higher out-of-hospital deaths due to CV-19 among these communities. Yet, while these are valid and complex obstacles to health equity, one barrier that healthcare providers can affect directly is the role implicit bias has in medical decision making. Did you know that there exists a study which stated that Blacks can handle pain much better than whites, and so there was no need for Blacks to be prescribed pain medication? Is that an unconscious act or a conscious act? Now, implicit bias refers to unconscious attitudes and stereotypes held toward other people. In the healthcare setting, when ideas about a patient are made because of unconscious association rather than that person's individuality, it can lead to poor care. For example, when Blacks go to the emergency room to seek care for whatever it may be, they could be, we could be in pain or whatever. You have some ER physicians who use stereotypes to define what we are there for. If we come to the emergency room, that means that we're either a junkie and we need pain meds. It means that we need a script so we can sell the pain meds on the street. That's why when I run into physicians like this, I feel personally, and from my personal experience, it is a conscious attitude that is being taken, not an unconscious attitude. Now, over the course of the CV-19 pandemic, numerous articles have been published on implicit bias and its role in the medical management of people of color. One piece detailed stories of Black patients being sent home from healthcare facilities with symptoms deemed not serious enough. Is it conscious or unconscious or pure? How can I put this without being too blunt? Too racially motivated. Yes, I want this to marinate. Let it just marinate in your system so you can become more empowered about your own health care. And I'm going to state this over again. Over the course of the CV-19 pandemic, multiple articles have been published on implicit bias and its role in the medical management of people of color. One piece detailed stories of Black patients being sent home from healthcare facilities with symptoms deemed not serious enough for testing, and then eventually dying at home from CV-19. Now, their families carry an added burden of wondering whether racial bias may have played a role in their loss. Past research has revealed racial disparities in medical treatment. For example, Black women were less likely than white women to receive radiation therapy, considered the standard of care for early stage breast cancer after a lumpectomy. Black patients hospitalized for a heart attack were found to be less likely than white patients to receive certain types of often prescribed medications and were less likely to receive an angiogram or be treated with more aggressive procedures. In an emergency room department in the early 90s, Latino patients with long bone fractures were twice as likely as white patients to receive no pain medication. In a more recent study, Latino men in California were less likely to receive optimal treatment for high-risk prostate cancer than white men. Many potential factors can be offered as rationale for these and similar results, including limited access to cancer care, a higher rate of coexisting chronic illness in Black patients with heart disease, patient's preference, cultural factors, or perhaps a physician's inability to perceive a patient's pain. However, implicit bias also may be a factor. Or simply, I'm going to take it another step. What about implicit racism against Black and brown people? A commonly used measure of implicit bias is an implicit association test. Remember that because I will be referring to it as IAT, implicit association test, in which test takers can be asked to link images of Black and white faces with pleasant and unpleasant words. Now, see, this reminds me of the test, I think it was done back in the 50s or 60s with the baby dolls. I don't know if it was Freud or Erickson's, where you have a white baby doll, which they considered bad, the child would consider bad, while the white baby doll was considered the good one. The Black child would always go to the white doll, quote unquote, the good doll. This test right here reminds me of that situation. Now, as participants, IAT, implicit association tests, measured anti-Black implicit biases increased. The likelihood of Black patients being recommended for a therapy for coronary artery disease decreased, while the likelihood of that therapy being recommended for white patients increased. Another study found that physicians with an implicit pro-white bias were more willing to prescribe narcotics medication to white patients following surgery than to Black patients. Stay with me and we'll return. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. And we're back. And we're talking about racial bias in medicine, subconscious barrier to CV19 equity. That's right. Are you letting everything marinate and sizzle? In the words of Country Wayne, in your spirit. I want you to become so proactive and to advocate for yourself. That's why I bring these situation and research to your attention. Now, getting back to the topic at hand. Implicit bias is ubiquitous and starts forming at an early age from repeated reinforcement of social stereotypes. Simply being aware of one's unconscious bias is a way to limit its impact on influencing decisions and behavior. Now, in the study that randomly assigned race to a patient with chest pain, an increase in pro-white implicit bias among physicians who were aware that the study examined racial bias was associated with a higher likelihood that therapy would be recommended for Black patients. Beyond personal awareness, however, explicit and consistent training and education and commitment to cultural competence is absolutely critical for the future of healthcare and healthcare workforce. Training should begin in medical school, as I stated way back in several podcast episodes ago. Every medical student needs to be aware of their own implicit bias so as they become a knowledgeable and skilled physician, they can make clinical decisions that's best serve to the patient. To help achieve this, the American Association of Medical Colleges and Organization has outlined learning objectives and guidelines for medical student education. Should explicitly include the reduction of bias in medicine as a goal for all other 172 accredited medical institutions. Now, here in Michigan, in the state of Michigan, serves as an example. In July, faced with the staggering statistics that CV19 was over 4 times more prevalent among Black residents than white residents, Governor Gretchen Whitmer issued an executive directive aimed at establishing rules requiring healthcare professionals to take implicit bias training to obtain or renew medical license in the state. Now, California lawmakers in 2019 approved a similar measure regarding the inclusion of implicit bias training in continuing education for healthcare providers. Meanwhile, the American Academy of Family Physicians offers a voluntary training option, noting that formal medical education and training often does not include a curriculum on implicit bias in clinical practice. The AAFP unveiled a training guide as a resource for providers. Just as all physicians must achieve sufficient knowledge of the structure and function of the body, all must also be trained in social topics that cause barriers to health equity, including the role they may inadvertently play in perpetrating those barriers. Patients who feel dismissed and stereotyped may be less likely to pursue follow-up care, leading to unmonitored disease progression and worse health outcomes. Bias also can fuel the existing distrust of the healthcare system based on historical and current examples of explicit and implicit racial bias that contributes to the reluctance of Black patients to participate in CV-19 clinical trials and to consent to receiving the vaccine. And you know, one reason when they say Black patients are hesitant, we all should remember the Tuskegee experiment. We all have to remember that, and we shall never forget that. And that's why some in the Black community are very hesitant and reluctant to seek care until it is at a critical stage, because they do not trust the doctors or the medical field, period. You have to have some type of acknowledgement and incorporate widespread efforts to address these issues of implicit bias. And you know what? My personal opinion, I don't believe it is a subconscious barrier. I believe that it is a conscious barrier to healthcare and health equity. It's dangerous. And until they make it mandatory, like the governor here did, that you take classes on implicit bias. And just like everything else in this country, in this world, racism and stereotypical thoughts about people of color exist. It exists from the courthouse to the White House. It exists. And do I ever believe that change will come where the medical field stop looking at people of color as people of color and look at us as individuals seeking quality health care? Not until they weed out, like they do everything else, weed out the bad doctors. I'm not saying that all doctors are bad. Some know how to hide it very well. But until they weed out, until they, before I should say, they finish medical school, they would have to have a curriculum in implicit bias against people of color. It should be a curriculum for that. Just like I've always stated, there needs to be a curriculum for bedside manner, because you have some doctors that really don't need to be doctors because they're just there to make that money and treat you like a piece of cattle. Roll them in, roll them out. Like you're building a car, roll them in, roll them out. To meet that quota. And especially if you work for a for-profit hospital, you have a quota to be met and made. So, please share your thoughts on racial bias in medicine. Do you think it's subconscious barrier or a conscious barrier? I'm curious to know, and I wish you would. Please let me know your thoughts. You can call into the show and leave a voicemail. It's right there for you to leave me a voicemail. Please let me know your thoughts on this. It is what it is out here. You have to become knowledgeable. You have to educate yourself. And most importantly, you have to advocate like you have never advocated before for your health. Stay with me. I'll be back. It's 7:52 p.m. Eastern Standard Time. And it's time for me to go. But before I go, I wanted to tell you why I was MIA on Friday. As some of you know, I formed a nonprofit, the Charlie E. and Minnie P. Hendricks Foundation for Chronic Illness Awareness. Since the inception of this 501c3 nonprofit, we have assisted teachers in 2019, I do believe, with school supplies. We have helped teachers that teach special ed students with supplies. We have bought medication for those in need. We have assisted with lights, gas, and even rent. So, since the pandemic hit, it has made it difficult for us to normally fundraise in the traditional manner. But I was setting some items on the My Story Living with Lupus website that is for sale, and 100% of all the proceeds go to the foundation so that we can continue to assist those who call on us in their time of need when they call the foundation. You will find brand new clothing items. We have a hidden treasure collection, which is from $5 to $20. We have some jewelry items on the site, and also there is lipstick developed especially for the foundation with the foundation's logo on it for the spring. You can go take a look at that. If you are able to make a purchase, please do. I think the lipsticks are regular $10. They are now on sale for $5 or 2 for $10. You can go over to https://mystorylivingwithlupus.com. Go to the menu and hit shop and see if it's something there you would like to purchase. It is Shop for a Cause. It started today, February the 6th through February the 28th. After the 28th, all prices will change. That's from clothing items to lipstick items. You have lipsticks in the shades of the deepest purples to the brightest pinks. The lipstick is highly pigmented. It is vegan free. It is vegan lipstick. I'm sorry. It is vegan lipstick. So go on over there and take a look. That's what I've been doing. And that's why I was unable to do an episode on Friday. But before I go, I want to leave you with this. Where is the wisdom we lost for the sake of knowledge? Where is the knowledge we lost for the sake of information? Only those who will risk going too far can possibly find out how far one can go. I'm Susan Hendricks, your host for My Story, Living with Lupus podcast. Have a most peaceful, safe, positive, and oh so blessed weekend. I'll talk to you guys next week. And don't forget to go over to My Story, livingwithlupus.com, hit shop, and shop for a cause. Thank you.